So thank you very much for the invitation to talk. My presentation is on the resuscitation of the COVID patient. As you've heard throughout the earlier talks, it's a very contagious disease, and also the mortality is actually quite high, particularly in the older age group. And I think what I would urge my colleagues around the world to consider is that when you see a patient with COVID, you should assess what your escalation of treatment plan is. And are you escalating all the way to intensive care? And are they suitable for a resuscitation order if they were to succumb to the virus? So hopefully my talk will briefly cover on the absolute need to reduce the provider, so the healthcare worker, from exposure to COVID-19, and how to provide oxygenation and ventilation with reducing the aerosolization exposure to the healthcare professional, and also to consider whether it's appropriate for starting resuscitation in the first place, and also whether we should continue it, and then a little bit about the guidelines on patients that go into cardiac arrest. So the unique challenge that COVID provides to healthcare workers, where their instinctive urge is to provide assistance, is that it is a very contagious virus. And so your personality or your personal safety is essential. And before we start any resuscitation, we also have to look around for safety. And in this case, the virus affecting the healthcare provider is a key one. So with the COVID-19 virus, and CPR being an aerosolized generating procedure, has to be at the forefront of our minds in all patients that we admit with possibilities of this condition. You may have heard throughout personal protective equipment, or PPE, and the media coverage with regards to whether healthcare professionals have access to this, or whether hospitals have provision for their healthcare. This is just a visual guide, which you can see with the diagram on the left. You have, if you're in contact with someone who's suspected of COVID-19, you should at least wear a mask. And this can be a surgical mask with a liquid-resistant gown, aprons. Ideally, you should have your arms and hair covered. And if you're then going to take part in an aerosol generalizing procedure, and this includes CPR, or intubation, you need to have eye protective gear. You need to have at least an FFP2 or 3 respirator, a long sleeve gown, and gloves. It's also important, always remember to wash your hands before and after you wear the protective gear. So the advice for patients in the community, if you were to see someone who's gone into cardiac arrest, the first thing to do is to dial the emergency number and get an automatic defibrillator. You should cover your own mouth first of all, and then the nose and mouth of the person who you would be resuscitating, and you perform only hands-on CPR as the routine 100 to 120 compressions per minute, and then you apply the defibrillator. In the hospital, the slight change to your basic life support and the advanced life support is, first of all, the safety is you have to wear the PPE. So if you don't have a PPE and someone has confirmed COVID, you really should not resuscitate until you yourself are protected. So you've done your personal protective equipment, you limit the personnel to only the essential team required in the room, and then you go down your usual algorithm. So you confirm that the patient is unresponsive by shaking. In the basic algorithm, you used to listen and feel for breath sounds. That's been taken out because you want to avoid proximity to the breaths or airways. And then you go about your chest compressions in the same manner that you will do. So you no longer listen or feel for breath sound to diagnose the arrest. You just feel a pulse on the carotid for 10 seconds and then commence CPR if you have confirmed arrest in the normal protocolized way. So this is a hospital simulation of a CPR. You can see there are minimal number of participants in the room. Everyone has full PPE kits with the visors, the masks, the hats, the long gowns and the gloves, anesthesia at the head, someone documenting and making sure that the right medications and protocols are formed. And chest, you only do chest compressions when everyone in the room has a level 3 PPE. So you do not start chest compression until everyone is gowned, because you put everyone at risk. So in the hospital, we use the same. So you go through your normal sequence of 30 compressions to 2 breaths. And again, you use a bag mask valve, which has a fitted filter attached to it, and you create a tight seal. And then when you get your intubation, you can do your continuous chest compressions. And then as usual, you go through your 4 H's and your 4 T's as part of your algorithm, and then check if you've got an ITU bed available very early on, because this will have to be the end point in terms of getting your patient to. As a cardiologist, in terms of the cath lab, we treat everyone as if they've got COVID-19. And so what that means is everyone has a full PPE kit. And again, as we've been through before, the visors, the masks, and we consider the full PPE kit for everyone who comes in with an ST elevation, myocardial infarction, or those who have a high-risk end-STEMI case. This is our gown we wear. So again, repeating what I've said, the visors, the masks, the respirators, and the gloves. And this is very important. So it's very important that you don your gown, clean your hands, don your gown, and particularly when you're taking it off, the doffing is the important bit, because that's when you can contaminate yourself. So it's very good to do that in pairs and to practice, practice, practice. So in the cath lab, we make sure our patient has a mask to prevent the spread of any aerosolization. We also wear a mask. And it is very important that we practice this, because the first time you do it, you're not used to having to wear PPE. So it's very important you do regular simulation type practice, because practice will be key to success for you to get quick. Also update your local protocols with regards to how CPR is done and the need to wearing your PPE kit, and education through videos, webinars such as this, and podcasts are very important. So that's just a quick summary of resuscitation. Happy to take any questions, and hope I've got you some time back.